Hello, my name is Charlotte. I'm one of the infection control nurses here. The infection control team have put together a little question and answer video as a fun little initiative for the World Hand Hygiene Day. Why is it important to ensure good hand hygiene?
Hand washing is the single most important thing you can do to prevent infection. Ensuring that you use the 6 stages of hand hygiene that are on all the wall-mounted soaps and gel dispensers, and using the 5 moments of hand hygiene set by the World Health Organization.
What are the possible effects if there are incompliances with hand hygiene?
Incompliances with hand hygiene mean we've forgotten to clean our hands. It might be that we've forgotten to clean our hands before patient care or after patient care or before a clean procedure, for example. And it means we might pass germs or bugs or microorganisms that are on our hands to the patient or from one patient to another. And the consequence of that is that a patient can get an infection, and we want to do whatever we can to stop that from happening. And hand hygiene is the most important thing to stop that.
How do we measure hand hygiene within the trust and the measures we put in place if there are incompliant staff?
The way we measure hand hygiene in the trust is that members of the IPC team, or perhaps others in the trust, it might be a particular person identified on your ward or department, will do an audit of hand hygiene. So the way they'll do that is they'll look to see moments where hand hygiene should happen. So there's the 5 moments for hand hygiene that the World Health Organization give us, like before patient contact, after patient contact, and so on, as has been covered before. So we'll look to see when those moments happen and see whether someone cleans their hands or not, and if they do, that's marked down as compliant, and if we don't, then that's marked down as not compliant, and then we'll add it all up at the end and work out the percentage. So when you see a hand hygiene percentage for a ward or clinical department, that's what it means. And then when we come across non-compliant, where someone misses an opportunity for hand hygiene, the way we would deal with that is we take that person aside and just explain to them that they've missed an opportunity, and quite often the person will just say, "Oh yeah, I'm really sorry, I knew I should have done, I just forgot to do it on that occasion." Sometimes a bit of education is needed, and we're happy to do that. We would then just make sure the manager in that area is aware, because it might be that that same person has been repeatedly failing to do hand hygiene, which is obviously a risk to themselves and to patients. And then we would leave it at that. But if we found that that same person was repeatedly doing it despite us having a chat with them and the education, there's an escalation process that's in the hand hygiene policy. So we can escalate to have a sort of more formal conversation with your manager, and then if that doesn't work, then to have remedial training, and to escalate to a higher level as Associate Director of Nursing for nurses, or equivalent for other specialties, because we do really take this seriously. We can really cause harm to our patients if we don't clean our hands. So first step, we'll just try and make sure people know what they should be doing, but please do wash your hands, because we do take it seriously if you don't.
How can inappropriate use of gloves affect hand hygiene?
Inappropriate glove usage can often affect hand hygiene compliance due to gloves giving members of staff a false sense of security whilst wearing them. Most of the time, gloves are not required, and we see them being overused when we are out and about on the wards. In most scenarios, performing hand hygiene after patient contact is often more useful in reducing the risk of cross-contamination than if staff members just wear gloves and fail to perform hand hygiene.
What are the common mistakes of hand hygiene?
Sometimes people forget to perform hand hygiene when they're moving from one patient to another. This is really important. This is one of the World Health Organization's 5 moments of hand hygiene, which Graham and Jean have already mentioned. It's very important that you remember to clean your hands from leaving one patient's bed space before you go to the next, because you could transfer bacteria or viruses from one patient to another, even if you don't touch the patient, because it could be in their patient zone. Another common mistake we see people make, and it's usually because people want to take precautions and they overuse gloves, and we see people wearing gloves in the corridor, sometimes handling notes or pushing empty trolleys, and there's really no need to wear gloves in these occasions, because it's more important that you can clean your hands when you're entering a new area or when you're leaving an area, because if you've got gloves on, you can't clean your hands when you leave or enter an area.